Hi, Patricia here from Rapid NCLEX. Today we'll be talking about surgical interventions used in management of myocardial infarction. In our previous video, we spoke of the medical management. So if this medical management fails, we'll have to rely on the surgical interventions. One of the surgical intervention is PCI, also called percutaneous coronary intervention. It's a procedure used to open up the coronary artery, and this is to be performed within 2 hours of the onset of myocardial infarction. So, meaning that if a patient had myocardial infarction and comes to the hospital within 2 hours, this intervention can be done for them. So during this procedure, a catheter with a balloon is threaded through the blood vessel. Usually, the femoral artery is used. So the catheter is threaded through the femoral artery, and then once they get to the blocked area of the coronary artery, the balloon is inflated and a stent is placed to restore blood flow to the heart. For our NCLEX exam, what we need to know as nurses is the post-op intervention or post-procedure intervention. Things we need to do as nurses. We need to monitor the insertion site for bleeding, and then we assess for perfusion to the extremities. So we'll have to check our distal pulses. So using our 6Ps, it will help us a lot. So we check for distal pulses, the color of the extremity, and then the temperature at the extremity, just to be sure that there is perfusion at that site. And then we'll also have to monitor for complications such as artery dissection or reocclusion of the coronary artery. So some of the signs of reocclusion of the coronary artery is that patient is going to have the signs of MI again. So there's going to be chest pain, shortness of breath, tachypnea, tachycardia. Okay. Our next procedure is coronary artery bypass graft. So this is a procedure that is used to bypass one or more of the coronary arteries due to blockade or persistent ischemia. So just like the name, they will use the patient's own other vessels, either an artery or a vein, and then bypass the occluded coronary artery just to help in perfusion or getting blood into the heart. Usually the saphenous vein or the internal mammary artery is used. This intervention is usually performed when the client does not respond to the medical management of coronary artery disease. So pre-procedure or before the procedure, I stated earlier that for any procedure that is invasive, we will need to ensure that an informed consent is obtained. So our key thing here is that we should ensure an informed consent is obtained. And then we also have to familiarize the client and their family to the cardiac surgical unit since it's a new thing to them. We'll also have to let the client know of external incision after the procedure. We'll also have to let them know that after the procedure, when they come, they are going to have chest tubes, catheters, IV lines in situ. Let the patient know the outcome of the procedure so that in case they are out of the surgery, they don't get shocked after. We'll also have to educate the patient of anesthesia to be given, and then we'll inform the client's post-op pain will be managed with analgesic. We'll also have to educate the client on how to splint their chest during coughing after the procedure. We'll also have to let the client know that if they are on certain medications, it needs to be withheld. So if the patient is on diuretics, it means that they will have to withhold it 2 to 3 days before the procedure. If they are on digoxin, it should be withheld 12 hours before the procedure. If the patient is on aspirin and other anticoagulants such as warfarin, it means that they will also have to discontinue it 1 week before the surgery. Also, we will need to monitor the patient's vital signs, especially their blood pressure. If there are any signs of hypertension is going to cause an increase in bleeding. So there will be more bleeding at the insertion site, which we don't want it that way. So these are some of the things we need to monitor. We'll also have to monitor the patient for their temperature. Any increase in temperature could indicate infection. So these are some of the key things we'll have to monitor the patient who has undergone a coronary artery bypass graft. All right. Thank you and see you in our next video.